Level 6 NVQ Diploma in Occupational Health and Safety Practice, RQF. F. 616-9531. Unit 2, Develop and Implement the Health and Safety Policy. Enhanced Limited Copyright 2019. How does the structure of the organization affect health and safety? Management. The organization structure affects how health and safety can be managed and whether it is being managed efficiently for the structure in place. Tasks and duties. Different team members within the structure will gain different tasks and duties dependent on their position. Health and safety policy. When looking at the health and safety policy, it is important to think: who should the health and safety policy be advocated to? Why is the advocacy of the health and safety policy important? How can the health and safety policy be advocated efficiently? The health and safety policy should be applicable to all stakeholders. Stakeholders may include line managers, senior management, health and safety specialists, safety committees, HR department, trade union representatives. How would you assess health and safety policies, procedures and strategies? When assessing hazards, there are 5 steps to ensure that the hazards have been identified, analyzed and that solutions can be deduced from the findings. Step 1. Identify the hazards. Step 2. Deduce who may be harmed, and how. Step 3. Complete a risk assessment and take action. Step 4. Make a record of the findings. Step 5. Review the risk assessment. Statutory workplace health and safety requirements. Input of products and/or services. The conversion processes. Output of products and/or services. Inadvertent, unwanted or unnecessary goods, materials and waste of all types. Employees, contractors and others affected by the organization's activities. External consideration. External consideration looks at external organizations who may be affected by health and safety activities and changes to policy. Some external organizations that may be affected are emergency services, general public contractors, visitors, trespassers, waste disposal. Resource constraints. It is important to manage and take into account the potential resource constraints. These resource constraints may include funding, time, finance, facilities, manpower, size of workforce. Opportunities to revise and revisit the health and safety policy. Within the organization's time frame, there will be many opportunities in which you can revise/revisit the health and safety policy. These opportunities might present themselves as meetings, memos, emails, consultations, presentations. Commitment to the health and safety policy. When looking at the commitment to the policy, we look at how we can improve stakeholder commitment. It is important to ask, who are the stakeholders? Managers, health and safety specialists, trade union representatives, emergency services, HR department, senior managers, safety committees, regulatory authorities. The application of quality management to documentation. It is very important that quality management is applied to health and safety documentation. Quality management ensures that all documentation is of the correct standard and ensures that it meets health and safety requirements. Documentation could mean any form of official documents such as policies, procedures, safe systems of work, risk assessment and accident/incident reports. The role of the health and safety policy. The health and safety policy is present in all areas of the organization. The health and safety policy can be used to convey many different roles. Some of the roles it could be involved in are communicating health and safety requirements, setting and monitoring health and safety standards, safety awareness, awards and recognition, short and long-term targets, meeting industry best practice, meeting legislative requirements. How can you research the organization's current health and safety procedures? There are a lot of different methods which can be used for research. Some of these methods are observations, essays, written assignments, looking at previous reports, information on the internet, comparisons to other organizations' current standards, meetings, reviews. How can individuals and groups become motivated? There are many forms of motivation, some of the more common being reward, recognition, training and fear. These are also the most common motivators within a company and within businesses in general. Training is a reward that is generally beneficial to everyone. Recognition can be a powerful motivator as people are more driven when they feel valued and recognized for their efforts. Reward is a great motivator but usually has a temporary effect when it comes to efficiency and standards. Fear is a powerful motivator but is not a very sustainable motivator when put into a business environment. Factors that can influence health and safety. UK legislation. Requirements/expectations from professional bodies. Regulatory authorities. Materials used in production processes. Location. Access to emergency services. Level 6 NVQ Diploma in Occupational Health and Safety Practice, RQF.